Good afternoon. Welcome to the webinar on graduate education programs. I'm Stephen Johnson, Professor of Healthcare Policy and Research at Weill Cornell Medical College and Director of Graduate Training.
Good afternoon, everyone. I'm Ariane Jung, Assistant Professor of Healthcare Policy and Research and Associate Director of the Program in Health Policy and Economics.
My name is Jessica Anker. I'm an Associate Professor in the Department of Healthcare Policy and Research, and I'm the Director of the Certificate Programs.
Here's what we're going to cover in the webinar, just a brief outline. First, we'll talk a little bit about the Department of Healthcare Policy and Research. Then we'll talk about the Master of Science in Health Informatics, the Master of Science in Health Policy and Research, the Certificate Program in Health Information Technology, the Certificate Program in Health Analytics, and then we'll wrap up and have time for questions. So let's look now at the department. The department is the Department of Healthcare Policy and Research. It's a new department at Weill Cornell. And our mission is to improve the delivery of healthcare and optimize its value. Our department conducts innovative scientific research. We also provide services to support healthcare delivery, and we offer a range of educational programs. The chair of the department, shown here, is Professor Renu Kaushal, who's an internationally recognized expert on novel healthcare delivery models and the effectiveness of health information technology. I encourage you to learn more about our department by exploring the website. But for now, let's look at education programs. As I mentioned earlier, the department offers 4 educational programs. Let's go through each one in turn. Jessica, why don't you start by telling us about the Health Informatics program?
Great, thanks. Our Master of Science in Health Informatics focuses on the use of information technology in healthcare. We look at ways that information technology is being used to organize, coordinate, manage, deliver high-quality healthcare, and areas where innovation is needed to develop better technologies. Our goal is to train people who are entering careers in healthcare delivery, such as hospitals and medical centers, health insurance, technology development, consulting, and academic areas. The curriculum for the master's program starts with a common core that all of our courses all of our programs share. These are courses basically introducing students to healthcare delivery, how hospitals and medical centers work, how to ask questions about these systems. We focus a lot on how to use statistics to answer questions, and how to understand and work with rich healthcare data. In the informatics program, students then progress to concentration courses in health informatics, which provide additional training in the health information systems that are in use today, health information exchange, healthcare quality, along with the methods that are appropriate to study and improve these systems, and the computational techniques that are used to analyze healthcare data.
Thank you, Jessica. Let's now look at the program for health policy and economics. Let's go to that page. Ariane, why don't you tell us what that program is about?
Thanks, Steve. So this program is designed to train the next generation of leading researchers and practitioners working to identify the most effective ways to organize, coordinate, and manage, and finance, and deliver high quality of healthcare. So after completion of this degree, students have career opportunity as a policy analyst in the healthcare industry or government organizations such as federal or state health departments and research institutes, academia, and consulting firms. So now let's take a look at the curriculum. So the curriculum for this concentration provides a strong foundation in health policy and economics. These courses will provide a strong foundation in essential economic concepts and current policy issues as they apply to healthcare. Students will become well-versed in the financing of healthcare, economic components of delivery system, and role of government. Students will also learn to apply advanced research methods to evaluate policies and programs while gaining hands-on experience on data analysis.
Thank you, Ariane. Let's scroll down now and look at the paragraph on the research project. Both of our Master of Science programs engage students in a hands-on research project. In this project, you work closely with a faculty mentor in a one-on-one experience. Working together, you do your project, and that ultimately culminates in a thesis. Our goal is to provide you with individualized training, access to specialized healthcare data sets, and interaction with other faculty and staff who are conducting research studies in that area. We also try to give you some experience in field work so that you could see how all of what you're doing and studying relates to healthcare delivery as it's practiced at Weill Cornell Medical College, New York Presbyterian Hospital, and our other partner institutions. Let's now go and look at the certificate programs. We currently offer 2 certificate programs. Jessica, why don't you tell everyone what those 2 programs involve?
The certificate programs do share some of the content in the master's programs, but they're meant for a different sort of student. We find that most of the people in the certificate programs are working professionals who want to take some coursework part-time in order to cross-train in a new field or else deepen their expertise in their current field. As a result, the certificate program courses are offered in the evenings to make it easier for people who are working. And we also allow, we try to develop a little bit of flexibility in the program so that students can do some of their requirements off campus as well as coming on campus once a week. The older of our 2 certificate programs is the certificate program in Health IT, or Health Information Technology. This program consists of 3 courses from the master's program: the course in Health Information Systems, the course in Health Information Exchange, and the course in Healthcare Quality. Our goal is to provide students with an introduction to current technologies used in hospitals and medical offices, as well as public health departments. And we also think it's incredibly important for students to understand trends in national and state policy. We are also offering an additional certificate in health analytics, and this is focused more on data analysis in the healthcare field. So the certificate program in health analytics consists of 3 courses: biostatistics, health data analysis, and computational methods, or data mining. Our goal here is to provide students with the basic tools needed to analyze big data in the healthcare field.
Great, thank you, Jessica. For the moment, let's go and look at the academic calendar page. So here you can get a sense of how these programs are delivered. All of the 4 programs that we just talked about require at least 1 year of study. The way we break up our year is there are 3 terms: a fall term that starts in September, a spring term that starts in January, and a summer term that starts in May. Each of these are 13 weeks. The calendar shown here is for the class of 2014-2015, and the next class will enter in September of 2015. The one after that is going to enter and begin in September 2016. Let's now look at how to apply to any of the 4 programs I talked about. Let's go to that page. So as you can see, applications are submitted online, and you can find instructions there for how to fill out those forms. I would like everyone to know that we've extended our application deadline. Now, the new date now for applying, the new submission date is the end of applications will be April 3rd, 2015. We do make our admission decisions on a rolling basis, so the sooner you apply, the sooner you'll receive a decision. So it's really important to get your application in as soon as you can. As you can see throughout this website, if you need to contact us at any time after this webinar, you can reach us through email at hpr-education@med.cornell.edu. So now we have some time for questions. Jessica, do you want to start us off with a question while people are thinking about?
Steve, one of the most common questions we get is what sort of background preparation are we looking for in incoming students? And I think the answer to that might be a little bit different for the informatics class and the health policy and economics class. So when we get people asking about the informatics program, historically we've accepted a pretty diverse group of students. Partly we want that diversity in the classroom, and partly it's because different people bring different strengths to their application. Typically, we're looking for some background in health or healthcare or biological sciences. That would be one area of strength. Or if students don't have that, we would be interested in background in some sort of computer science, engineering, or IT field. We typically do not expect students to have strength in both of those fields, but some perspective from one or the other is definitely strengthens the application and I think puts the student in a better position to really benefit from the program. We do also have some very strong applicants coming straight out of undergraduate, in which case their experience is largely in the classroom, which is great. And then we also get some mid-career people. For example, we always have a few MDs and a few RNs who come through the program. And these are people who obviously have very strong on-the-ground experience of health and healthcare and are looking for that cross-training in the information technology aspect of it.
Great, thank you.
I was going to hand it over to Ariane to talk about what sort of students might be best qualified for the health policy and economics program.
So Ariane, you were going to say?
So for health policy and economics program, we consider applicants from a variety of backgrounds, not just those who are policy or economics majors. Students typically enter from diverse backgrounds, experience, and interest, including medical professions, healthcare administration, public policy, population health, sociology, economics, and any related areas.
And we do have one question submitted by a webinar participant. The question was, do we have a sample class schedule? The participant is curious about the daily time commitments for the classes. Most of our classes are in the early evening, but we do have some classes that are in the middle of the afternoon. Again, for certificate students, those classes are in evenings, but for the master's students, not all of our classes are in the evenings. A typical 3-credit course is has 3 hours time commitment on campus per week. And most semesters, if full-time students take about 4 classes per semester. So I think that should give you some sense of time commitment. We do also have recommended half-time sequences of courses. We have a number of students who come through the program spreading out their coursework over 2 years, in which case they might take 2 3-credit courses per term. And complete their research project in the final year that they're part of the program. Other graduate programs encourage applicants to contact individual professors with similar research interests prior to submitting an application. Is this the case for the master's programs? I would say it's certainly appropriate if people would like to learn more about the department by searching on the department website and approaching any individual professors who look like they might have similar background. However, that's not required. We will do that sort of matching up in the first semester that students are here with us. I think typically my experience has been that for PhD programs where students are making a 5 or 6 or 7 year commitment, this is a really critical initial outreach. And for a master's program, I'd say that that's optional, but certainly a great way of learning more about the program.
One thing that we are often asked is about standardized test scores. Are they required? What's required? So for the certificate programs, standardized test scores are not required. So if you're thinking of either of the two certificate programs, you don't need a standardized test. However, if you've taken one, it's often good to report that, especially if you've done well, that can make you more competitive as an applicant. The two master's programs, standardized test scores are required by our graduate school. All of our programs here at Weill Cornell require that. Most commonly, people take the GRE. However, if you have taken the MCAT or the LSAT, those are also acceptable. We'll take those scores as well. But you do need some kind of standardized test in order to apply.
How could a full-time employee complete the master's program? How would you work out class and work schedule? And I think that's a great question. We do have, I think about half of our students are working while they take their classwork. It is certainly very possible. It does require a certain amount of flexibility in your hours. And so that might be something to bring up with your employer early on to find out how flexible your work schedule might be able to be. Many of the first-year courses are offered in the evening, and so for most employees that's not going to be a problem, especially if you're going half-time. However, as I mentioned, not every single one of the master's courses can be offered in the evening due to a variety of constraints. And so at some point, some flexing of hours will be required in order to take those courses.
But some of the faculties, they offer a class maybe like once a week for 3 hours. So maybe that will give you more flexibility.
But it is definitely something that we've had previous students do quite successfully, and it does require some, I think, open discussions with your employer just to make sure that if you need to take a class, one afternoon a week, that you might be able to flex your hours the rest of the week to make up for that.
Great, thank you. So one question has to do with how the certificate program relates to the master's program, and can you transition? So yes, as you could see from the courses we were describing earlier, the certificate programs use the same courses that are part of the master's programs. So if you do either of the certificate programs, all the credits that you amass by completing those programs would count towards either of the master's programs. That said, you have to apply again in order to be accepted into the master's program. So obviously your chances are pretty high if you do well in the certificate program, but you do have to submit a new application because you're applying for a different degree. But yes, you can transition from one program to the other. You could also, if doing well and if the committee permits, you can also transition part way and your credits would be carried over.
Great. Steve, we've got a question about virtual attendance to classes, either through recording, non-synchronous attendance or webinar sort of attendance. And I will say we have done a little bit of experimenting with that. We do not currently have a program that would allow a student to take an entire course virtually. That is something that we are likely going toward in the future, but currently we don't have a system set up that would allow students to do that. If there are individual situations in which a student might have to miss class, we had a couple of snowstorms last year, and we held a couple of classes by Skype, which worked pretty well. But no, currently we do require on-campus attendance for the programs.
Great. I will point out, though, that if you missed a class, we use course management software, so all of the materials for all of your courses are online. So all of the slides used in lectures, handouts, homeworks, all the readings that are assigned, they're all available online. So if you do, unfortunately, have to miss a class, there's a lot of material there for you to read and study on your own. And of course, you can always interact with the instructor for that course and catch up for anything you miss or any questions that you have at any time. So yeah, we'll definitely work with you to make sure you can get through the course.
We have a question about average class size. To date, our classes have been pretty small. We have a very high faculty to student ratio, so generally 10 to 15. That may grow a little bit in the coming year, depending on the application numbers. But in general, these are fairly small programs.
Other question that we're asked a lot is about the ability to attend part-time. So let me just explain the rationale for how we've designed the master's programs. Those were designed to be completed in 1 year. If you really want to, and I encourage, if you're able to do that, I really strongly encourage that. You just get it done in 1 year. And as many of you know, if you're looking at master's programs, a lot of them are 2 years and require a 2-year commitment. But ours can be done in a 12-month calendar year, as I was talking about earlier. So that's probably the best way to do it if you have the time to focus and get through it in that intense experience and get your degree. On the other hand, if you are working full-time and that is not achievable, you can do it part-time. And that typically takes a little longer, maybe 1.5 years, and some people have taken up to 2 years to complete the program. But you work through the same courses and engage in that project I was talking about exactly the same way as those people that would be doing it full-time.
We've got a question asking whether it's possible to complete the program in 1 year while working full-time. And I would really say that would be very challenging, particularly when it comes to trying to complete the research project, which typically takes a lot of extra hours on the part of the student to complete that. In addition, not all of our courses are offered in the evening, and so there are some courses that are required for the programs that are offered in the afternoon, and that's certainly possible for students who are working to flex their hours around that, but I think it would be extremely challenging to try to complete all the coursework in a high-quality fashion while working full-time as well. We've had quite a number of students come through while working 50%, and that has seemed to work fairly well, but I think it would be challenging to work full-time and be a full-time student as well.
I think we had one student who did that successfully, so it is doable, but you have to be really committed, obviously, to carry a job and get through a pretty intensive 1-year program at the same time. So it can be done.
We've got a question. Do you have a class schedule that we could present to an employer to work out hours and stuff? Yes, absolutely. That is a completely reasonable question. I think currently it's not available online, so probably the best thing for you to do is to email us at hpr-education@med.cornell.edu, and we can send you those details. Thanks for that question.
There's another question about what's an ideal applicant? Well, it does depend on which of the 4 programs you're aiming for. Earlier, Jessica talked about some of the different backgrounds you might have if you're interested in the health informatics program, and Ariane talked about some of the backgrounds you might need for the health economics program. But to sort of, so you should go and if you're either of those are your interests, we can focus in on that, or just more generally, the typical background is a bachelor's degree that people have coming right out of undergraduate, and they may not have had a focus in these areas. And as mentioned both by Jessica and Ariane, we have a lot of diversity in our students, so it's really hard to generalize to say, well, all our students are such and such. I would say that that having a passion to learn about healthcare and how to make it better, if that's something that really interests you, and using advanced methods to do that, whether those methods might be economics or analytic methods or informatics methods, that would be another thing that you would really have to find that fascinating and challenging. So if that's for you, I think this would be a great program to match that sort of interest.
We've got a question specifically wants to focus in on health policy and economics, asking about the ideal backgrounds for students, and then also what sorts of future careers those students can look forward to.
Yes, just like I earlier mentioned, we consider applicants from the variety of backgrounds, not just those who are policy or economics majors. Students are typically enter from diverse backgrounds like experience and interest, including medical professions, healthcare administration, public policy, sociology, population health, economics, and any related areas. So for after completion of our degree, students have careers opportunity as a policy analyst in the healthcare industry or government organizations. For example, like federal or state departments, research institutes, academia, or the consulting firms. So these employers increasingly need individuals with advanced skills in analytics, economics, and policy evaluation, or decision science and implementation science. And also I want to mention is students who want to pursue further studies after our master's program are well prepared for a PhD program in related areas.
There was a question about finding out the schedule about when classes are offered so you can plan. So a lot of that information is on the website. If you explore, you go into you can find out let's say you're trying to do it in 1 year. For example, there are 3 terms. You can see what courses are offered in each term and what days and times of the week those take place. If you're not finding enough information in detail, please email us at the email link that's provided all throughout the website, and we can provide you a much more detailed schedule if, for example, you need to share that with your employer.
We've got a question about the distinction between a master's in public health and the master's in health policy economics. What would be the similarities and differences? And this is a particular person who has a background was working in quality improvement patient safety. Yeah, so what's the distinction really between an MPH and the master's in policy economics?
I guess that some of actually many of the classes MPH offers are similar to our program. For example, like our core classes, we offer biostatistics and clinical research. That's epidemiologic method classes. But however, our program is just like a name implies, policy and economics. We offer a lot of this health economics class. So, for example, this is more technical terms, but we learn a lot about health economics methods called econometrics method. So, how to analyze our policy and economics. So that would be maybe the kind of one distinction from MPH in our program.
I think I think that's a great question. Public health often focuses on a variety of the social underpinnings to health. Mm-hmm. I would say here in our programs, we're focusing on the specific area of economics and the role of policy in shaping the healthcare system and in shaping the health outcomes in our country. Also comparisons with other countries, very frankly. So an MPH might expose you to a variety of different areas, whereas this master's program in health policy economics might be going deeper in this particular field of economics and the policies related to it.
we have a couple of questions about what our acceptance rate is. We're a fairly new program, so this rate is changing over time. We have more and more people applying every year. The program is pretty selective. We would probably take the upper 25% of those that apply. However, as we were talking about in terms of backgrounds, what do we look at? We're going to be looking at standardized test scores, but not exclusively. We're going to look at your GPA, but not exclusively. We're really interested in the personal statement that you write. Where are you coming from? Why are you exploring this program? What are your passions for doing this? That's really important. Also, the letters of recommendation you get. Always good to ask people who know you really well and really have something to say about why this educational experience is the right thing for you. So try not to pick people who don't know you well. So it's a competitive program, but we're looking for unique individuals who come from some interesting backgrounds and really have the desire to work in this space and try to make healthcare function in a better way.
There's another question for Health Policy and Economics program. What if student does not have any economics background? So the students, I can say you don't need economics background to apply our program. So we are not requiring advanced quantitative skills or economic background. So our core course, which we take in the first semester, will prepare you for quantitative course in the second and third semester. So, for example, core courses include introductory statistics and health economics. This will prepare students for the more advanced course in the program in later semesters.
We also have a question about students who might have less than strong undergraduate academic backgrounds and then significant work experience. And I will say, I'm speaking about the informatics programs in particular, we've had several students who would have, I think, fall in that category. So, for example, we've had students with a complete humanities background who then ended up working in IT, and it turned out that their IT background was much more relevant to what they wanted to do with the future of their career. And so they pointed that out. I think a good way of explaining that to the admissions committee is to direct in your essay is to direct attention to the areas where you think your strengths are, and talk about why, say, your work experience is actually much more relevant today than your undergraduate academic experience. We certainly have had a number of people with non-linear career paths who've experienced that as well. That said, we still are a pretty competitive and selective program, so for example, if you've got extremely strong GRE scores or something that might offset undergraduate grades, you can also direct attention to those.
Right. So that just points out again that our applicants are really diverse. And so if you feel your experience and training so far is unique, you're welcome to the club, so is everyone else. But it is really important to write a strong personal statement. That is really the piece that, more than any part of the application, pulls together all these different facts from your background and points out, what's really salient. So that's your opportunity to explain why, in this particular case, your work background would really be relevant and prepare you for this kind of training.
We've got a question about whether students who are enrolled in our programs can also take undergraduate courses. I just want to point out that our program is here in Manhattan on the Upper East Side. That's where Cornell Medical School is. Cornell undergraduate programs are offered in Ithaca, which is 5 hours away. There's no particular cross-registration policies. Certainly students are welcome to take courses in other programs. Whether they would count towards your master's program is a question that would have to be decided on a case-by-case basis. We do have a procedure where if students would like to transfer credits from other programs to this program, we ask that they submit a syllabus as well as their transcript, and we'll make a judgment on a case-by-case basis about whether it's sufficiently similar or sufficiently relevant that we should accept the credits to this to the master's program. We've got a question about what software packages the analysis courses use, and is background in programming important? I think that's a great question. Most of our courses currently use R, which is an open source statistical language. We also some of the courses introduce students to Stata, and some of the faculty work in SAS, so we've been doing a couple of different things. We certainly expect all students to start learning R. All of our courses, the first semester, we introduce everyone from the ground up. So if you do have a programming background, I think you're going to be well positioned in those early courses. But we certainly have a wide variety of students who don't have programming background, and they can do extremely well as well. So in addition, for the biostatistics class, you will learn a program called R. But for the health policy and economics program, for the concentration course, there's a data course and there's one econometric course. You will learn how to use SAS and Stata, which is a statistical package that are using for analytics.
Again, everything we've covered, if you missed anything, is on the website, so I encourage you to explore that. And there's a frequently asked questions page that may have the information that you're looking for. If you don't find what you need, please do contact us at any time, and we'll be happy to answer any of your questions.
And I think with that, we'll be wrapping up our webinar today. Thank you very much. Again, please feel free to follow up, and we look forward to hearing from you.
Thanks, everyone.
Thanks, everyone, for attending.